Hello everyone, welcome back to the YouTube channel of Shree Swaminarayan Physiotherapy College. All those viewers who are new to our channel, please do not forget to subscribe our channel so you do not miss any new notifications. I am Dr. Stuti Shah and today we are going to talk about cancer rehabilitation in brief. What is cancer? Cancer is basically a pathologic process which is characterized by dysregulated cell growth and their spread. The patients who are having cancer can undergo various types of treatments. That can be surgery, radiation therapy, chemotherapy, immunotherapy, hormonal therapy, targeted therapy, or stem cell therapy. Post any sort of treatment which they undergo, they'll be facing some sort of impairments. These impairments can be fatigue, pain, hernia which can occur because of transposition of muscles, lymphedema, scar formation which can lead to some sort of activity limitations, or they can even suffer from amputation. The patients may experience cardiopulmonary insufficiency, nerve palsy and postural changes, restricted range of motions, and muscle weakness. There has been a growth in the number of survivors who have been either completely treated from cancer or whose cancer has been temporized. These patients are eager to lead a good quality of life and a productive life. The aim of cancer rehabilitation is to focus on treating the physical impairments. For that, we can go for range of motion exercises, we can go for resisted exercises, we can go for stretching, aerobic conditioning, and manual lymphatic drainage. Flexibility exercises. With the help of flexibility exercises, contractures can be prevented, or they can be mitigated, or they can be even reversed. Whenever you are advising stretching exercises, those stretches should be held for 3 to 5 breaths, and these stretches are performed for 5 to 10 times. For range of motion exercises, you can start those exercises immediately after your radiation therapy has started. These exercises are performed at least twice a day and should be continued for a period of at least 1 year. Your resisted exercises are giving resistance and strengthening the muscles. The muscle groups which are treated are both that of your upper limb as well as your lower limb. Your training is done with 60 to 70% of repetition maximum, 8 to 12 repetitions, and 2 sets of these training exercises. With the help of resistive exercises, you can improve the strength and quality of life, along with improvement in fatigue and perceived exertion. In your aerobic conditioning, these sessions are performed 3 times a week with 60 to 80% of your maximal heart rate. With the help of aerobic conditioning, there is reduction in fatigue, insomnia, emotional distress. Also, there is a reduction in thrombocytopenia and neutropenia. Manual lymphatic drainage. Your manual lymphatic drainage is given in patients who are having lymphedema. During their first phase of complete decongestive therapy, manual lymphatic drainage is given daily, which is followed by compressive bandages, which you can observe in the figure on the right hand side, which is given for a period for 21 to 24 hours. In the later phases, the patients are advised and given compressive garments. There are few precautions which you will have to keep in mind while treating a person who has suffered from cancer. The first one is that going for deep heating modalities. You cannot go for deep heating modalities when you're treating a person who has suffered from cancer. The second one is massage. Massage is quite debatable, but you should keep precautions while treating a person who has suffered from cancer. Thank you everyone. I hope this was a informative session for you. Please do not forget to like, share and subscribe our YouTube channel.